So there we go. Hello, guys. Hello, and good morning, good evening, wherever you are in the world. I know I have some. Oh, Sandu, hello. How are you? Okay, so I have some nurses coming from India as well, and then some nurses coming from the African area. Hello, guys. It's your coach again. It's that time of the week again. Of course, Sunday in the US, Monday in the Philippines, as well as all the other parts of the world. And we are now once again going to have an NGN drills discussion. So if you could remember, 2 days ago, I actually placed this module that is in front of you at the moment in our study group in Facebook. For those who are on TikTok and are joining me right now, I do have the link of our study group in Facebook in my bio. Feel free to visit us there. I've already placed all modules there, previous recordings, anything that will be necessary in your preparation for NCLEX. So I actually uploaded this, and we've already finished multiple activities like analyzation drills, as well as analysis drills, as well as that of prioritization drills. But I will be repeating some of them again because I just received a lot of inquiries about it. Now we'll go all out NGN. Okay, so a lot of people have been asking for this. Would it be okay? Okay, would it be okay that we go all out with NGN questions? Of course, of course. The reason why I started with analysis, prioritization, and then eventually evaluation, it's because that is being graded in NCLEX. Okay, it's already being graded in NCLEX right now. So apart from the new, okay, new appearance as well as the new structure of questioning in NCLEX, it's not just all. It's no longer just rather grading you on what you know in nursing, but also on how you think as a nurse. And guys, this has caused a lot of problems for new NCLEX takers. And if I would just like to point out, the passing rate for NCLEX for the first quarter of 2025 for international nurses is only at 48%. Okay, out of the 13,000 who took it, that actually went down from 55% that was the previous passing rate for quarter four of 2024. So that tells you that NCLEX is upping up their game. They're increasing the difficulty. Why? Because they would want you to be tested not just on what you know in nursing, but how you apply all of this knowledge, particularly in practice. Okay, so without further ado, let's begin our discussion. So for those who were able to download this in the group already, you do know for a fact that we are already, okay, focusing on the case studies. So NCLEX really loves to throw out case studies right now. In fact, in every NCLEX, there is at least 3 case studies with a total of 16 question. And for those who have been my students for the past few months and for years as well, you do know that one question in NCLEX could decide how are you going to fare with the exam. How much more 16? Okay, so that is what I'm pointing at this moment. You need to be ready when it comes to this types of question. These are not the ones that you got used to if you're studying in the Philippines. You've been studying, or if we have student nurses right now coming from Southeast Asia, as well as that of India and African region. This is not the typical, okay, not the typical multiple choice. So just for a little bit of practice, because we're still practicing at the moment as we are going to progress the difficulty, I have created 5 case studies with at least 2 questions each. In that way, you will have a little bit of a desynthesization primarily on the activities. Okay, now moving forward, let's begin with our discussion. Question number 1, and most of you might have seen this. This is an example of a bow tie question, and I want to emphasize how important this is. Bow tie questions are considered one of the most, okay, most difficult as well as the most comprehensive questions that you could encounter in NCLEX. Because what is going to happen here? This is all about applying the full concept of clinical judgment, which is unfortunately being graded by NCLEX right now. So you apply everything here, understanding the cues, um, understanding the cues, analysis of the cues, prioritizing your hypothesis, taking action, and then eventually evaluation. So this creates, okay, this creates an actual question that is not just challenging you, but is totally evaluating you on how you think as a nurse. So, what would be the best strategies on this one? Of course, apply your clinical judgment. Focus on the cues, understand what the question is all about, and what does the case shows you. What type of clinical picture is it presenting in order for you to actually answer this better? So let's deep dive into this question. So you now have a 19-year-old African American male with a known history of sickle cell disease, and he is now in the emergency department with a severe generalized pain in the body, particularly in the legs as well as that in the chest. He reports that the pain began after spending time outside in cold weather. So why am I emphasizing the ones that you're seeing right now? Why am I highlighting this, especially for those who are in the TikTok group? Okay, this is how you identify cues. When you're talking about cues, okay, mhm, when you're talking about cues in NCLEX, it is all about every relative information that is essential to make, okay, that is essential to make a clinical decision. So what are those? Okay. In this type of question, it involves the demographics of the patient, the race of the patient, the previous history that is being presented by the patient, the initial signs and symptoms that were felt or were observed by the person, as well as that of the progression of how that history, as well as that of the current condition, connects with one another. So, putting it simply, with everything that we have placed here, that you have an African American with sickle cell disease, pain primarily on the legs and chest, particularly on the joints, and of course, the patient spent time outside in cold weather. That essentially tells you that there is a possibility of O2 deprivation, which could have been a trigger for your sickle cell crisis. Okay. Or otherwise known as your vaso-occlusive crisis. So, sir, you've already given the answer to one of the choices. Okay. So, moving forward as well, don't forget your vital signs. Okay, my dear nurses, do not forget your vital signs. Your vital signs also gives you, okay, an idea of what's happening with this patient and how are you going to move forward with answering this. So if we're going to notice, you could literally see that there are indicators of pain, and at the same time there is that increase in temperature. And what does increase in temperature shows you systematically? Okay, thank you, Anna. You were able to give me the correct answer. That is an indication of inflammation, which is, of course, going to create, okay, those pains. Why? In vaso-occlusive crisis, your sickle cell being, the shape, okay, is not essentially biconcave. So what again is the purpose of a biconcave shape, RBC? Okay, guys from Google, it is essentially for the purpose of, the reason why is it biconcave is because this allows the red blood cell to actually change into a torpedo-like shape, increasing its ability to perform diffusion as well as that of transfer of nutrients and oxygen. This is its normal shape in order for it to facilitate oncotic pressures in your capillaries to actually exchange, okay, oxygen and nutrient contents. Unfortunately, when you have sickle cells like this, instead of this being torpedo like, this actually becomes, okay, it agglutinates, or it actually sticks together, resulting to the presence of an occlusion primarily on your smaller blood vessel. The result is inflammation of the area because of the pooling of the blood, excessive pressure, and of course, if there would be excessive pressure in your capillaries, it will then trigger third spacing. Okay, but enough of the pathophysiology. The main thing that people are getting it wrong primarily with NCLEX is that they think. The reason why I'm telling you your pathophysiology is that you need to also understand the disease progression in order to answer this question, but you don't need to think too much of it. What do you need to understand here is, as a nurse, what are you seeing? What are you going to do? And what are you going to monitor? That is essentially what is it asking for you. So first, have you noticed, we've identified the cues, we analyzed it in a way that, hey, this leads to this, and then eventually will lead to this. And that's what's going to happen. What's going to happen? Vasoocclusion occurs. So what would be the best thing for us to do here? We've already established this. And then there's also a noted grimacing, particularly with the patient, and guarding in the limbs, and continually asking for pain medication. So this person is essentially vaso-occlusive crisis. So in answering this in NCLEX, because I cannot do it, I'm very limited in the PowerPoint, as well as that of the as well as that of articulate, because I'm using articulate sometimes. This is a drag and drop question. So the choices that you are seeing here are essentially draggable. You could literally click it and place it in order for you to actually complete the concept that is being presented in the bow tie. So we've already established there is a history of sickle cell. Once sickle cell will encounter deprivation of oxygen, it will begin to accumulate vaso-occlusive crisis. So the condition is letter C. Now, let's begin with the things you needed to monitor. Okay, so what are the things that we needed to monitor for this patient? Let me see in the TikTok group. Oh, Raquel is already giving an answer. Pain and hydration. Very good. Mm-hmm. So let's focus first. Begin first with your monitoring. Why do we need to begin first with monitoring instead of going to the do? Because a lot of people forget about the reality that if there is an active acute condition, there should also be continuous assessment and monitoring. This has been seen by the study of NCSBN altogether. The reason why you have NGN right now, because that is a product of a 6-year study from 2016 all the way to 2022. And the question is, what makes a nurse to commit an error? And they were able to see it's about the way that we think. Critical thinking is not just enough. You need to apply not just your nursing knowledge, but also the nursing process altogether. Now, in order for us to identify what would be the best and the most effective intervention, we need to monitor and assess the patient correctly. That's why in answering bow tie questions, focus first on things to monitor in order for you to actually cluster the way that you are also thinking. Do not attack this question as if it's one big question. Yeah, it is a question, it's a big question, but it has multiple parts. Again, you needed to identify the condition, and then you would also need to create your own monitoring or an assessment pattern, as well as that of your interventions to be done. So take it one at a time. Follow, ADPI. Assess, diagnose, plan, intervene, and then eventually evaluate. Okay, let's now do this. Now let's go with the monitor. What are the things that we are going to monitor for this patient? Okay, let's see. Okay, very good. The first one that we needed to look out into is your pain level. Okay. Always remember it's your pain level because the pain level is an indication of what? Okay, it's an indication of hypoxia. It's also an indication of what? It's also an indication of further occlusion. So the more that the pain increases, the more that it becomes okay dangerous because what's the biggest concern when we have sickle cell crisis? Remember, when we have that crisis, first it will become vaso-occlusive crisis, and then it will become splenic sequestration crisis, wherein all of the red blood cell will eventually pull into your spleen simply because it needs to, okay, it needs to decrease, okay, it needs to decrease it, and at the same time it's destroying multiple red blood cells, resulting to the third level of your vaso-occlusive crisis or your sickle cell crisis, which is your hemolytic crisis, eventually leading to aplastic anemia. Okay, so the more that the pain is increasing, the more that it is worsening. Then what would be the next thing that we are going to need to monitor? Mhm. Another thing that we needed to monitor is, okay, for those who were able to join my hematology class, more likely you've known this. We're going to also look into urinary output. Okay? Why do we need to? Because urinary output actually indicates your overall hydration status. And hydration status is essentially the one that will tell you if you have effective circulation. Okay? This is critical in any form of sickle cell crisis. Why? Because we need to ensure that there is no occlusion, that there is continuous circulation. What's the importance of circulation again? Of course, oxygen delivery, nutrient delivery. That is why if there is effective circulation, there would also be an effective urinary output. Thus, circulation will eliminate the inflammatory reaction caused about by the buildup of the sickle cell, decreasing in the pain level. That's the reason why you want to prioritize this too. Now, what are the things that we needed to do moving forward with this? Okay. So, of course, if that is a problem of circulation and oxygenation, our main priority would be to apply your IV, okay? Apply your IV fluids. Okay, we need to make sure that there is increase in the overall circulatory volume. Because why? There's already hemolysis during this time. There is also third spacing during this time because of the pressures that are built up. So you needed to replenish water. And hydration essentially help reduce sickling, okay? Or the actual accumulation of your, okay, problematic red blood cell. Therefore, increasing the circulation, increasing oxygen delivery. So another thing that we needed to also do is to administer oxygen. Okay? That is letter D. Why? Because the main reason why sickle cell crisis happens is because the body first goes into a compensatory mechanism simply because of the lack of oxygen. So what would the body do if there is a lack of oxygen? It would increase circulatory functionalities. Unfortunately, since you have sickle cell that will end up sickling and building up, it will create blockage to your small blood vessels. So again, this is based on the cues. So just a recap, we identify first the cues. We connect the cues with one another to give us the clinical picture, which is essentially the condition. The next step is, of course, for us to prioritize our action. And we could only prioritize if we know how to assess. And then eventually we do and we perform our necessary functions or we initiate the necessary interventions. Okay. So how about everyone? Are you are we able to get it? Okay. I almost forgot the TikTok was live. Hello guys in TikTok. Are you learning? Are you learning? Okay. Hopefully you are learning, guys. So there will be more of this. I promise you that. Okay. Now let's move forward. In some cases, there is a progression of the case studies. And one of the students here in Google actually told me that her case study was like the entire ADPI. Yeah, that is true. It begins in assessment. There's a question about assessment. What would be the next diagnosis and all of that. But we're not going to go there yet. Okay. I don't want to, I don't want to bombard you with too much of that. That is something that we're going to practice, and I will create a session for that for you as well. Let's just, let's just practice around two cases, or rather, two questions per cases. Next is a highlight question. Okay, also the thing that is a bane for most people who are taking NCLEX at the moment. In a highlight question, you needed to also perform your clinical judgment by evaluating the nurse's notes that is being presented to you. Oh, let me just fix this one here. Okay. And then eventually you need to answer the question by highlighting what is being presented at the moment. So it could be a nurse's note, just like what you see in the sample question that I'm presenting to you. It could be a set of laboratory values. It could even be a set of doctor's order. So the technique here is plain and simple. Again, go back to your case, identify your cues, analyze the cues, and then apply, okay, your AdPi on the question. But this time, it is essentially here. Indicated in the question, the subject is, this is a note at 7 a.m. So this is already a progression of care. We need to highlight the information that is now indicating improvement on the patient's overall condition. And as you know, we are talking about sickle cell disease. So, with the patient having vaso-occlusive crisis on the first question, this is like the update after you have done your monitoring as well as that of your interventions. So don't be surprised if it is a progressive, okay? So if it's a progressive question, because it is designed like that. All case studies in NCLEX are assigned, or rather, are actually designed in a way that follows the flow of clinical judgment. So you could always encounter a progressive one. Okay, let's now try to answer this. We were able to establish a while ago that you have a vaso-occlusive crisis. We needed to decrease the dangers that is being brought by vaso-occlusive crisis. We monitored the pain of the patient. We also monitored the overall hydration status, and then eventually through the urine output. And then we intervene by improving the circulation plus improving the oxygen. Now, with all that at hand as your initial evidence and additional cues, the next thing is what would tell us that everything is actually doing good. So let's look at the notes. At 7 a.m., the patient was seen to be alert and oriented times 4 with a mild chest discomfort during deep inspiration. The respiratory rate is now at 20 breaths per minute with the O2 saturation of 95% on room air. The temperature, if you remember, the initial temperature that we have was at 38 degrees Celsius or 100.4 degrees. It is now down to 37.2 degrees Celsius. The productive cough is also being decreased, and in the lungs, there are scattered crackles but no indications of wheezing. The patient is also ambulating in the room with minimal fatigue, with a capillary refill of less than 2 seconds, a pain rating of 3 by 10 or 3 out of 10, and is already voiding clear yellow urine. And it's also, okay, the patient is also tolerating good oral intake. So, our problem a while ago is what? Our problem is circulation. Okay, and we already did all the interventions on the previous question. So, what are the things that will tell you that there is actually good circulation? Okay, let's use the highlighter here. Mhm. Because this is how you really answered it in NCLEX, okay? You'll literally highlight it. So, could we consider, okay? Could we consider alert and oriented times 4? Okay? A lot of people got it wrong because of that. Okay, this is baseline. Okay? If you have a baseline thing such as ANO4, you do not use that or you do not include that as an answer. Why? Because again, this is a progressive question. Case studies are progressing questions. So you must take or you must highlight answers that are relevant to the initial question that was presented to you. A lot of people got this wrong because of this. And later on, after we answer this, I will also share with you how is this being scored. Okay. So ANO4 is baseline. It's expected to be good, so we're not going to include it. So again, your main thing to focus on are circulation improvement. So let's look at the note again. The patient is having an O2 saturation of 95 on room air. Is that a positive one? Okay, is that a positive improvement? Yes, it is. It is a positive improvement. Now let's look at the temperature. Okay, the temperature that is actually going down to 37.2. Okay, here in the US, we considered fever starting at 37.5. So 37.2, but the fact that from 38 degrees, it's actually 37.2, this is also an indication of an effective circulation because it already relieved the systematic inflammatory reaction. Okay, the productive cough is decreased. Is that a good one? Is that also an indication of circulation or in circulation circulatory improvement? Yes, it does. Why? Because the reason why the patient is having crackles as well as buildup is because of, remember what I told you? Pressure is building up on your capillaries, resulting to a reverse and oncotic pressure, third spacing of fluid. And what's the most common thing that's going to happen? Pleural effusion. That's why your vaso-occlusive crisis is a very dangerous condition altogether. So if there would be a decrease in productive cough, it only means that the circulation had cleared up on your lungs. Okay. How about ambulation in the room with minimal fatigue? Would we consider this one? Yes. Okay. In any form of circulatory compromise, fatigue is your number one sign and symptom. And finally, the last one, your capillary refill, your pain rating of 3, and avoiding of clear yellow urine. Are these actually indicators of good circulation? Yes, it is. Okay. So this is how you answer this question. You highlight all the necessary information that is being presented. So again, how did we end up with this? Because the question is all about vaso-occlusive crisis, which is the thing that we are supporting. Therefore, we look into the evaluation that is focused on circulation. Thus, these are your correct answers. Okay, did you got it right, guys? Okay, the Google team, yes, very good, very good. Oh, don't worry about for those who have forgotten one line, okay? Just like what I'm telling you, it's better that you get it wrong here, okay? Get it wrong here. I don't care if you have 10,000 mistakes in my class. This is not about who's going to be a, magna cum laude, summa cum laude, or whatever. This is for you to practice and to learn. The main thing, the main reason why we're doing this is for you to be exposed to how NCLEX looks like. And what you see in your screen right now is the exact replica of how an NCLEX question as well as the user interface is looking like. Okay? So make sure that you focus on the learning. Don't focus on your mistakes. Rather, learn from it. Okay? 10,000 mistakes is also 10,000 learnings once it's corrected. So always remember that. Okay, so our TikTok people are here. Thank you guys for joining. Hope you're enjoying as well. Okay, let's now go to our next set of question. And now this is focused primarily on your 72-year-old male with a sudden onset right-sided weakness and slurred speech about an hour ago. Okay. So what does this tells us? Okay. Again, let's identify the cues. You have an elderly patient and there is a sudden right onset or right-sided weakness. Then, if you're going to look at the vitals, it's actually showing you an increase, okay, in the BP, 180 over 98. A little bit of an elevation there. Heart rate is still at 90. Auto saturation is at 95. Respiratory rate is at 18. Glucose is 102 milligram per DL. The orders that were given by the doctor includes a CT or a CT scan of the head. You also have labs. Patient was placed on NPO, and it was actually triggered if the patient would be qualified for a TPA. What is a TPA? Anyone who could give me what a TPA is? A TPA is a tissue plasminogen activator. Essentially, this is your super clot buster. The current status of the patient also indicates that there's a weak grip on the right hand, complaints of numbness on the right lower extremities, and the patient appears confused, looking for words when answering. Okay. Now, with all of this at hand, we identify the cues. We analyze now. What are we seeing in the patient? Let me see. TikTok people, let's see. What are we seeing at the moment? Okay. A lot of people are joining. So this is how hard it is. To be honest with you guys, I'm very new in doing it in TikTok, but I want to do it in this way because sometimes when I'm doing the Google Meet, only a handful of people could come in. It's either they are on their shift or probably sleeping at the moment or something like that. Okay, let's see. So what's happening at the patient? This is okay, very good, Sandu. This is an indication of what? This is a okay. We are now dealing with a stroke. And since we are seeing that the patient is essentially having, okay, since the patient is essentially having TPA as a consideration for treatment, what does it tells us? What does it tells us? What does it tells us? It tells us that this could be an ischemic. Okay, this could be an ischemic stroke. Okay, what are the type of stroke? Mhm. We have your ischemic stroke, otherwise known as your okay dry stroke, courtesy of a clot or an infarct that had built up in a major artery going to the brain. More likely, that would be your MCAs, okay, your ascending cerebral arteries, and all of that. And then we also have your wet stroke, otherwise known as your hemorrhagic stroke, which usually happens if there would be, let's say, for example, traumatic brain injuries, as well as that of aneurysm to the brain, and of course, if there could be some buildup of subdural or intracranial hematomas. Point of the matter is, let's focus on what is actually presented at the moment. We're talking about an ischemic stroke. Now, what are the things that we're going to focus on based on the question? Now, we are being presented by what you called as a matrix. Okay, this is a matrix um, or a grid, multiple choice, select all that apply. So the reason why you are being given this types of question is for you to identify which are errors, which are priorities, and which are the things that are not even related to the interventions that is intended for the condition. So as you can see, we're still applying the clinical judgment the clinical judgment measurement model approach and the way of thinking that is expected for a nurse. We identify the cues, we analyzed it, we started to identify the condition, and then we now prioritize our activities. So let's now do the prioritization matrix. Using the grid below, align the correct actions for the nurse to do based on the given situation for this patient. Essentially, this question is simply saying which of the following are the things that you need to do now, you need to do later, and things that you don't do at all. Okay, so let's begin. Is it necessary that we initiate NPO? Nothing for OREM. Do we do it now? Do we do it later? Or we don't do it at all? Very good, guys, on the Google group. We do it as much as possible, as soon as possible. Why? Stroke impairs the ability of some individuals to swallow, making them a dysphagia risk. Therefore, any form of intake could actually either lead to choking or, if that is a fluid, would eventually lead to aspiration pneumonia. Therefore, we need to make sure that we place the client on NPO, no questions asked. Are we going to initiate a peripheral IV access? Yes, this is also a top priority because again, you have an order for a CT scan. Therefore, a CT scan would actually need a contrast. And at the same time, you are also triggering TPA eligibility. Don't forget about it. So you're about to give Altiplace. So you need to have access on IV because Altiplace can only be used through IV, especially in this situation. Do we need to send the patient immediately to the CT scan? Yes. Why? Because there is what you call a time sensitive protocol. Okay. So yours truly is actually a neuro nurse working. My main work in the hospital is essentially as a neurological unit, neuro unit, stroke unit charge nurse. So this is like an every day, every night thing for us. So why is it a time sensitive one? Okay. What's the time sensitive rule? Okay. Because we need to actually rule out if this stroke is really an ischemic attack, or it could probably be a bleeding altogether. Okay, always remember that there is that 90-minute rule when it comes to survivability, especially if there is a stroke or a myocardial infarction. It means within the next 90 minutes, all the necessary intervention, if including imaging, reperfusion, control of bleeding, should have already been done. So therefore, your CT scan or CT scan of the head is a gold standard to ensure that you are about to give care for the patient, especially if there is a running order for TPA eligibility. Okay. Now, are we going to administer aspirin? Okay, is it something that we consider? Okay, we don't do it. Okay, we do not do it because your aspirin, okay, being an NSAID could actually be giving you an antiplatelet function, and it could create, okay, it would create what? It would create, it could create bleeding. So we do not give any form of those medication unless we have established that there is no bleeding. And yes, again, guys, keep in mind that we want to take out the possibility of bleeding before we intervene further. Now, is it necessary for us to obtain TPA at the moment? We can do it later. Okay? So we focus more on doing, okay? On doing stabilization of the patient's condition before we actually go forward. Okay. So this is how you answer it. Now, what is the impact? Sir, can I let go of a certain item here? No. When you see a matrix question such as this, you need to align every item specifically to the criteria that is presented on the right. Why? Because matrix multiple choice usually have what you call a negative or positive negative scoring. So what is a positive negative scoring? Very simple. Right minus wrong. Okay? NCLEX is now scoring a right minus wrong protocol, especially if that is a prioritization question, because this is a matter of life and death. This is where your clinical decision truly matters. So if ever, let's say for example, you place administer aspirin as due later when it's not supposed to be done at all, that will be minus 1. So if you got the 3 correct, let's say for example, you have the 3 correct, and or let's say even consent for TPA, you got it correct, this is going to be 4 minus 1. This would give you 3. And then based on how the actual question is being designed in terms of computer adaptability, it will then decide the difficulty of your question. But it's this, since this is a case study and they go in bundles, it will be evaluated as a whole after you answered all 6 case study questions. Your overall score for that case study will then decide what would be the next set of questions that you're going to receive in NCLEX. Okay? I just want to highlight that because a lot of people are like, sir, why is it that when I had this coaching about a few days ago, I was able to do good with my case studies, and then eventually the question became easier. Unfortunately, that young lady wasn't able to make it in her NCLEX. Okay, because that's how NCLEX really works, guys. Okay, it will decide how the question will progress depending on how you answer the question. So this is just a public service announcement. If there would be someone like Mr. Mark, Mr. Jones, Mr. whoever that will tell you through a Telegram chat or in a Facebook group that you are joining with and will tell you that they could give you your entire NCLEX exam, that's a scam. Okay? Be very careful with those ones. Do not interact with them. They are going to scam you out of your money. So as much as possible, try to look for every one of us who are doing this for free, and we're doing this for you guys. Okay, just like and follow. Just be aware and be focused on your review. Again, NCLEX is never easy. It was never designed to be easy, and there's no shortcut for it. Okay, that's only a public service announcement. Let's now go to our next question. Again, a bow tie question. Mhm. Oh, there's a question. Hello, sir. Can you rate how hard the actual exam? The exam of NCLEX, okay, NCLEX is actually based on Bloom's taxonomy. Okay, that's a different topic altogether. But I will create a content for that and a module for that so that you will understand why is it NCLEX doesn't have a fixed difficulty. Why is it that it could become easier and then eventually it will turn to become harder as it progresses. Okay, we now have another ribbon. Okay, we now have another ribbon uh, question here, or bow tie question. Now, again, we are going to identify a condition, your nursing actions, and 2 things to monitor. Okay, so what are the things that we're going to focus on? The condition, we have already established it. This is ischemic. Okay, this is ischemic stroke. So what are the things that we're going to monitor first? Mm-hmm. What is the thing that we're going to monitor? Mm-hmm. Let's see. People there? Mm-hmm. Very good. We need to monitor INR. Okay. INR. levels. Okay. Because it's already established here. There's an addition, right? CT is negative for bleeding. TPA is now initiated. So one thing that you have, particularly with the TPA, especially with altiplase, is that it could increase your INR level. So what else? What else are we going to monitor? Mm-hmm. We're also again going to monitor NIH scoring. Very good, Melvi. In TikTok, she was able to answer it. Okay, what is NIH? National Institute of Health Stroke Scaling. If your score and that assessment will start at 4, it already is indicating minor stroke. So essentially speaking, in the quickest way possible to discuss it, the higher your score, the more profound the stroke is. So if your NIH, especially with that ischemic attack, becomes lower, let's say, for example, your NIH score started at 16 and then eventually it goes down to 4 or 5, that is an indication of improvement. Why? Because in ischemic stroke, we are, okay, our patient is experiencing hypoxia of the brain. If there is hypoxia of the brain, there will be a decrease in the overall functionality of the brain. Deficits will then be present. So, what are these deficits that we're seeing? Drooping of the face, okay, dysarthria or the slurring of speech. There could be aphasia in this case of the patient. The patient appears confused. So there's like a presence of comprehensive aphasia. And then, yes, very good, Hibin. There is also fast. Okay, so there's changes in the facial droop, arm is limping, slurring of speech, and of course, the time well. So you've already answered it with the fast because the fast is the Cincinnati, okay, the Cincinnati evaluation. So you now have identified the last known well as one thing that you're going to do. Why do we need to identify the last known well? Okay. The last time that the patient was well, why do we need to identify him? Because that is the basis of your, okay, that is the basis of your TPA. Okay. You can only, you can only give your altiplase or your tissue plasminogen activators if there is at least or less than, okay, 4.5 hours from the initial onset of, okay, initial onset of your stroke. Okay. So that's the reason why we needed to know the last known well. And of course, what's the other thing that we needed to monitor, especially that we now activated TPA? Any form of any form of bleeding, right? But there's no bleeding there, sir. Would it be good that we're going to look for a BP reading or the static pressure? Or do we allow patient to sleep? What do you think? Okay. Very good, Anna. We assess for this. The moment you give, okay? The moment you give your TPA, you assess for this one. Okay. Why? Because if there is an immediate bleeding caused by the TPA, your BP may not be able to show it immediately. If there is a sudden, very good, Hibin. If there is a sudden new onset of headache that is happening, this is an increase in your intracranial pressure, which only means one thing. There is now bleeding in the brain. Okay? There is now bleeding in the brain. So this is the most important thing that you're going to look because again, if there is be a new onset headache, that is also going to create neurologic changes. You would easily see it in the patient decreasing their overall level of consciousness. They become a little bit more lethargic. And then out of nowhere, they will now have more profound cognitive deficits. Sometimes they cannot speak anymore. Very good. So yes, ALOC or in otherwise, as the people in my students in the US are saying here right now, AMS. Okay, altered mental status. Mhm. Okay. So there was a question. Why the condition is ischemic rather than hemorrhagic? Okay. Because again, we base it primarily on what is presented on your case study. Okay. The reason why we are actually placing it on that case study because on NCLEX, you will answer your question based on the evidence that is being presented to you. And by the evidence alone, you could see there are orders for TPA. If you're going to notice that there is sudden right-sided weakness, there's no indication of a severe headache that the patient is feeling. So putting it all together, again, this is the first two parts of your, okay, this is the first two parts of your NCLEX, or rather your clinical judgment. Okay, so very good for those who are able to answer it. Again, the condition is ischemic stroke based on what is being presented together with the interventions that are being provided. And then we are also, okay, we are also indicating what? We are also looking into the last known well because there's already an indication of tissue plasminogen activators, and you will always look for changes in your ICP. Okay. So for those who got it correct, thank you very much. You got it correctly. Okay. Now, let's go to the next set of questions. So this is now another case study with a different format. So I wasn't able to create the the drop down boxes because for some reason I tried it in Articulate as well as that of PowerPoint. It is not showing the animation of the actual drop down boxes. So what you see here is your close. Okay, that is your close multiple choice. Wherein this is actually focused on clinical reasoning. Same thing, it could be presented with the case studies as you could see here. So let's go and do a deep dive on the case studies. Mhm. Oh, Chiran was asking, sir, is this what the NCLEX questionnaire looks like? Yes. Yes, this is how it actually looks like. This is your new generation of NCLEX. Okay? That's why a lot of people are been have been saying, been telling me to actually do because most of the questions that I'm doing here, and some most of my students actually knows it, I'm actually developing it on my own. So that's why I could only go live every now and then because I'm also preparing questions because of intellectual properties. I do respect that being a professor as well. I don't want to grab someone else's because I've seen a lot of that. I'm not going against other content creators on this one, but if you're going to showcase this one, uh create tutorials and all of that, create your own because it's a little bit disrespecting because I've even seen people using Archer and then putting it live. Guys, that is illegal. Okay, especially those creators in the Philippines. I am telling you from firsthand experience, we've done that before. We receive a letter coming from the US Embassy. So please do not tread the needle with it. Okay, as much as possible. Okay, if you're going to create this one as tutorial and to help other nurses, great fresh ones. Okay, just to help. I'm here to actually help you. If anyone who would want to to know more how these questions are being developed, I'll be happy to help you guys as well. Okay, but okay, let's now proceed with this one. We now have a patient who is a 24-year-old who just delivered vaginally 2 hours ago and is now complaining of dizziness, blurring vision, and sudden weakness. An assessment was done for the patient, and it was seen that the fundus is boggy and saturated the pad or your maternity pad 15 minutes already, or in 15 minutes with at least 4 incidents of such. The BP is now a little bit decreased at 88 over 50, and the heart rate is now at 122. Essentially, we are now seeing a patient who is having compensatory mechanism. So, what would be the best thing that we're going to do about this one? Look at also your labs. Okay. Some people are actually just saying to look at the top. Okay. Also, guys, Also, the main reason why this case study is presented as such, because there is a significance primarily on the labs that you are showing at the moment. So make sure that you also check the labs and you also analyze what you are actually seeing in your question. Okay, so let's now try to answer it. We are able to see that the hemoglobin is a little bit decreased from the regular range of 12 to 16 gram per DL. The hematocrit is also decreased at 28%, coming from a range of 36 over 46. There's also a little bit of a slight elevation of the WBC. The platelets are a little bit within the normal range, but nearing the lower point. And then finally, the PT or the prothrombin time is coming up at 16.4 from 11 to 13.5 as your main reference second. So your close, okay, your close drag and drop question would like to test your analysis as well as that of your actual reasoning. Okay, so what are we going to do about this? Let's try to answer it layer per layer. Okay, so look at a close question, okay, as a consequent or rather a consensual, sorry, not consensual, but a sequential, that's the word, a sequential multiple choice that supports one another. Okay, very good. So let's try to do it now. Let's begin with a boggy uterus with a heavy vaginal bleeding would indicate. Oh, a lot of people are already answering in TikTok. Thank you very much, guys. You're getting it right. You're getting it correct. This is uterine atony, one of the most common complication for post-vaginal delivery. Okay, it's not amniotic embolism, it's not infection, it's not even uterine prolapse. Uterine prolapse is more of associated with cancer as well as that of old age. Now, we already established that your patient has uterine atony. What would be the best initial interventions? So we will begin with, are we going to initiate blood transfusion, increase oral fluid intake, massage the fundus, or we're going to facilitate ICU transfer? Okay, so the best answer is, oh, I think we're having some we're having some OB nurses here. Thank you for joining. Very good. We massage the fundus. Okay. We massage the fundus first because, again, you will answer first with your dependent nursing intervention. Okay. Why are we not going to increase oral fluid intake? Okay. It will help, yeah, it will help in the circulation. But the thing is, it is the it is the uterus that is becoming so soft. Okay, by principle, you need to make sure that the uterus is constricted the entire time in order to prevent further bleeding. Now, what would be the best fluid that we may anticipate? Okay, a lot of people in TikTok are also debating. Okay, the best answer is LR. Very good. We will start LR. Why? Why LR? Why LR? Because it restores intravascular volume. Okay? So what happens is when you have uterine atony, it could cause significant blood loss. LR is the most, okay, it's the most balanced. Yes, plain NSS is as close to the blood, but LR is an isotonic crystalloid that closely mimics plasma. So what is that? It it actually allows volume replacement, but at the same time, it also maintains blood pressure and establish perfusion. Okay, that's the main importance of LR. So essentially, LR contains what? It contains everything. It contains sodium, it contains potassium. I believe there's also calcium, a little bit of protein, chloride, and of course, your lactate. So what's the importance of lactate? Once it's metabolized in the bloodstream, it becomes bicarbonate. What is your biggest concern in bleeding? Lactic acidosis. So your patient is turning into metabolic acidotic state. So what can you correct it with? Bicarbonate. And lactate, particularly coming from your LR, is the one that could correct it, therefore preventing further bleeding from your patient. And the good thing about LR is that it supports perfusion while preparing for your blood products to actually be prepared. Because you cannot just start a blood transfusion, right? There's a type in screen. Even though that is something that is a stat, you still need to do type in screen. Now, why is it not NS, sir? There's a question in the Google chat. Sir, why is it not NS? Because your NS create what we call as your hyperchloremic metabolic acidosis. Okay? It doesn't directly occur from the uterine atony altogether. But the problem is it could be a complication of your fluid resuscitation. Why? Because your plain NSS is zero point 0.9. Okay? Massive fluid resuscitation with normal saline is actually going to create more hypovolemia because of what? Mhm. Your NS has very high chloride. That's why it's having hyperchloremia. So the excess chloride disrupts your acid-base balance, resulting to the actual release of your bicarbonates, which is essential at the moment because you don't want any bleeding to occur and you don't want any acidosis to happen. Okay, so that gives you the reason why LR is your main priority. Okay, are you learning, guys? Okay, for the Google team, thank you very much. For the TikTok people, thank you for joining. Okay, so hopefully this is helping you guys. Don't worry, I will try to create more of this. So magtatagalog ako ng konti kasi po yung lolo ninyo ay sobrang busy. It's almost the end of the semester here, and the program that I'm teaching is essentially also a fast track in nursing. Would you believe it? 1 year RN na sila. Ganun yung program na inaano ko. Kaya ano kami dito, bugbugan talaga. But anyways, once the term is over by around August, I'll probably become more active when it comes to doing live. But hopefully, guys, you're learning and you're enjoying at the same time. Okay, let's continue on. We also have the next question, which is a prio. Okay, here we go. Another prio grid question. So moving forward with the case still at hand, using again the grid below, place the correct level of prioritization for each of the identified intervention. Again, let's do it row per row. Oh, there's a very good question I just noticed. How many months from Chiren, how many months do you recommend, sir, when it comes to studying NCLEX? Okay, the best way and the best time and this is actually coming from an actual study, okay, guys? Yours truly had been an instructor for NCLEX for a good probably 13 years. And in at least 3 years of that, I was leading one of the biggest NCLEX scholarship through a BPO in the Philippines once upon a time. And we did a study during that time. I would proud to say that I have a very great group of people with me that was helping me. We were able to produce at least 400 passers. And what we've noticed is the same thing. Even if you're working or not, at least 2 to 3 months of preparation. Okay? 2 to 3 months of preparation with at least an hour or two of reading and an hour focusing on practice questions is good. So as a treat for you guys, because some of you might have just seen me in TikTok right now in YouTube. If you're going to go to my bio in TikTok, if you're in TikTok right now, there is a link to our Facebook group. You could join there. I had there a module for a 2 month NCLEX study plan that is free to download. Yes, that's yours. That's yours. You could use it. You could actually use that as a reference to create your own 2 month plan. Yeah, it's just that it's in the Facebook study group. So yeah, follow my bio if you're looking at it on TikTok. For my Google class at the moment, you could actually go into our into our um Facebook group, and the resource is there. There's also a mock calendar included in that module, so that you could identify what would be the best plan for you moving forward. Okay? If you have just passed the NLE, okay, tatagalog ako ng konti, lalo na doon sa mga nakakapasa lang sa NLE, guys, if you can take the NCLEX as early as possible, take it. Okay? Take it, because I hate to say it like that, but most of the programs back in the Philippines is the same, primarily when it comes to NLE. The way that they have been running it. It's like a repeat of your NLE review, with of course a little bit of modification depending on each of the review center that you're joining with. Point of the matter is, why am I actually urging you to take the NCLEX after you have just taken the NLE? Because your brain is still fresh. The problem for some people, why they pass, why they fail rather, it's because they had been out of practice, as well as that of out of reading the literary context that they've already forgotten it. Okay, so if you're just a fresh graduate, go ahead. Mhm. Yes, I know it's a little bit costly. So don't worry about it, guys. If my if my initiative will be able to help you, much like your ates and kuyas in the past, who were able to, most of them are now in the US. Some of my students are, I'm very so proud that they're also instructors already. Okay, take it. Even there in the Philippines, it's a very big thing. Okay, having a USRN in your name in the Philippines is already a big deal. Not because of the title itself, but the job opportunities that you could have. And that's another story for another day. Okay, let's now continue answering this. What would be the prioritization of each interventions that we have? So, first, fundal massage, top priority? Yes, this is top priority. Administering oxytocin, is it something that we're going to focus on? Yes, administer oxytocin. Are we going to do Trendelenburg position? Okay. If there is already significant decrease in the blood pressure and a possibility of an indication of your bleeding. So this is not a priority, but still a possible answer. Measuring the lochia, especially lochia rubra. Okay, yes. So how do we measure that? The change of the padding, di ba? We're going to we're going to focus on how many times that we are changing the pads. Is it necessary to ambulate the patient? Oh, let's give him a little bit of movement, okay? Of course, this is contraindicated, okay? The best way for you to address this is to lay the person flat so that you could easily identify, okay? Easily identify changes in the consciousness. And of course, if you're going to have the patient walk, especially with a continually decreasing blood pressure, hell, that's going to create a problem when it comes to orthostatic hypotension. And the next thing you know, your patient is falling. So instead of you having a problem primarily with the bleeding, you now have a problem with a fall to add to it. Okay, so bed rest. Very good. Okay, now let's move to our next question. No, why is it not? I think the battery of my pen just died. Anyways, let's move forward here. There we go. We now have, okay, a 63-year-old with history of AMI, spinal stenosis, major depressive disorder, and CHF was admitted due to severe dyspnea after walking his dog at 1400. He is gasping for air and is having noticeable weakness. Patient is still ANO4, but is having difficulty of speaking. Bilateral crackles upon auscultation was noted, and edema of the lower extremities was also observed. The patient did indicate that this has been for the past 3 days and was not able to consult with his provider about it as he retired 2 months ago. The vitals, patient is a little bit hypertensive, 150 over 92. HR is at 108. Respiratory rate is an indicator of distress already. And the auto saturation is going down at 89 at room air. The BNP is a very significant 1,280. Okay. PG per ml, as well as that of the sodium is a little bit decreased, and your potassium is a little bit high. So what are we looking at the moment? Okay. We're placing, okay, apply our clinical judgment approach a while ago. These are all your cues. Okay, for the Google team, since the patient has a history of CHF and everything here is actually indicating what? This is what you call a decompensated, okay, decompensated CHF. There you go. Or otherwise known as to an acute exacerbation of your congestive heart failure, wherein your heart is no longer able to maintain adequate cardiac output to meet the circulatory demand of the body. Okay, usually this happens if your ejection fraction is already at the levels of at least 35 to 45%. This also is an indicator of profound damage to the lining of the heart, particularly on the left, okay, on the left ventricle, resulting to the inability, okay, the inability of the heart to pump out effective blood. So what is the difference of that with compensated CHF? When you're talking about compensated CHF, the heart has reduced functions. It's true, but it could still support circulatory capacity unless there are some events like strenuous activities, okay, decrease in the oxygen demand, as well as that of, let's say, for example, infection, wherein the heart will have a hard time, okay? The heart will have a hard time to actually perform its function. So what's happened there is that in your compensated CHF, you have your sympathetic stimulation wherein the heart rate is increased in order for you to support the circulation and sometimes the contractility as well. There is that RAAS activation. That's why in compensated CHF, you could see that patient could also have hypertension. But the one that would tell you if there is already an uncompensated CHF is the overall capacity of the patient to perform function. Therefore, fatigue is now present. And there would also be indications of volume overload. Sir, where did you get the volume overload? Look at your case again. Bilateral crackles upon auscultation was also noted. Okay? That is already volume overload, including edema of the patient. There is also tissue hypoperfusion. Therefore, the patient could no longer maintain activity. That's why you will have the classic, okay, you will have the classic four problems of your, okay, classic four problems of your heart failure. That includes congestion, that leads to edema and effusion, dyspnea, fatigability, and organ dysfunction, particularly those that is associated with your circulation, kidney, liver, and such. Now, with that at hand, due to the low sodium and high potassium, the nurse should, what are we going to do? The biggest concern if you have decompensated CHF is that it could create, okay, arrhythmias. Very good, TikTok guys. Okay, so we need to monitor if there would be arrhythmias. Mhm. Especially for hyperkalemia. What is going to happen? Let's see. What does hyperkalemia gives you? Okay. I leave it up to you guys, okay? Okay. So in our discussion, this is not going to be, oh sorry, I'm just fixing the, okay, I'm just fixing the camera because I think I hit it a little bit. Okay. The BNP is also elevated, indicating what? Mm-hmm. What's happening here? Okay. It's showing very good. Volume overload. And also an indication on the other side of the fence that there is continuous stretching of the ventricles. So what would be the best prescription at the moment? Very good. You go with the very first one to do right now is diuretics. Okay? In every form of congestive heart failure or heart failure, acute, let's be consistent with that. When you're talking about acute heart failure, it's always about congestion. And the best way for you to actually prevent any complication is to take out that congestion. And the best way to do it is with your diuretics. Okay? That's why we will start. Very good, Raquel. We start with your Lasix. Okay? Provided that it will allow, okay, your kidney functions are also variable. Okay? So, what if there's a kidney function? Now, stop. Don't ask that question. Why? Because that will just confuse you further. The technique and one of the golden rules of NCLEX, never question the question. If there is a question that is presented to you such as this, together with all the actual cues, signs and symptoms, progression of disease, focus on that alone. It is not telling you that there is a kidney problem. Leave that alone. Therefore, if you have CHF, furosemide, diuretic. Don't think too much of what if there's a liver problem, what if there's a kidney problem. Again, it is giving you a situation that is as specific as this. Focus on the situation. Okay, now we have a progression of care question on this one. So the patient, okay, so what happened was there is an update for the patient by the outgoing nurse 2 days post admission. Use it as the basis of answering the succeeding question. So the nurse notes at 4 a.m. 2 days later, the patient is dyspneic on exertion. There is also crackles, okay, at the basis upon auscultation. O2 sats drop to 88% on ambulation with a need to be placed on 2 liters nasal cannula with visible orthopnea. There is also a 3 plus edema, and the morning weight taken is now at 184 pounds. So, what would be the thing that we're going to focus on this one? Okay. Very good, Hibin, in TikTok. The best way for you to address this, since this is already a complication. There is now more than water retention. So we need to notify the provider and see if there is a need to adjust the diuretic. Okay? So we need diuretic adjustment. That's the only way. Or if we are going to look at it, it could be furosemide together with bumetanide could be added, or hydrochlorothiazide. So those are the things that we are considering here, okay? We're not going to encourage ambulation because that is going to worsen the patient, because look at this. The patient is going down in oxygen at 88 during ambulation. So bed rest is necessary for it. We're not going to increase dietary potassium because there's no indication there that the potassium is lowering. Okay, your labs is still at 5.4. And then are you going to document addresses in the morning? The patient's already dead. I'm sorry to tell you, but that's going to be the thing that's going to happen, because this is now going to a worsening heart failure. Okay. So, sir, could it be like that? That's just like a priority question altogether? Yes, it could be. That is now how random NCLEX is. So be very mindful of the clinical judgments. That's why I'm practicing you. Identify the cues, analyze what's happening, then prioritize what do you think would be the condition that is being presented at the moment. Do your actions, and then eventually evaluate if the actions are effective. Okay. Final two questions for the day. Okay, question number 9. Okay, this is Mason T, 7-year-old male. The diagnosis is acute asthma exacerbation. Allergies is for penicillin. Medical history, asthma diagnosed at the age of 4 and uses albuterol inhaler as needed at home. Okay, so you already established. Mhm. So he came in with the general assessment of wheezing and shortness of breath for the past 6 hours, coughing, especially at night, difficulty of speaking full sentences, retractions on inspiration. Auto saturation is at 91 at room air, still good, but the respiratory rate is 32 per minute. Then the heart rate is also elevated at 112 beats per minute. The doctor ordered the following: oxygen via nasal cannula and to maintain SpO2 above 94, albuterol nebulizer every 20 minutes for a total of 3 doses, oral prednisone at 2 milligram per kilogram of patient, IV fluid access, and cardiorespiratory monitoring. So, we analyze the cues. These are the presentation of your patient. Now, what are we looking at? We are looking at acute exacerbation of acute exacerbation of asthma. Very good. So, Mason, 17-year-old with asthma, is receiving albuterol nebulizer treatment and oral prednisone during an acute exacerbation. For each statement below, select true if it is correct based on the pharmacological principle or false if it is incorrect. Yes, pharma also now has a true or false in NCLEX. Okay. Probably, sir, you might be just creating this or whatnot. Okay. This was actually discussed back in 2022, as well as that being emphasized back in 2023 when I was able to last join the NCLEX conference for courtesy of the NCSBN. So yours truly had been lucky enough to grab another seat in this year's NCLEX conference. That's why by September 10, if there would be some updates, yours truly will be happy to actually share it with you again. I'll be posting it everywhere just for you to be aware and just for you to be ready. Okay, sir. Okay, someone asked me in I think someone in Gmail also says, "Sir, I'm just taking NLE at the moment, National Licensure Examination for those who are not aware in the Philippines. Would this be a good review for me as well?" Yes. Mhm. So I'm also elevating this to people at TikTok, okay? If you are taking NLE right now, practicing with an NCLEX question could also be good, okay? And if ever that you have questions, I'll be more than happy. Send it over, okay? Send it over to me in my on my social media sites. I'll be happy, okay, to answer your questions. Okay, let's finish this one. Albuterol is a short-acting beta-2 agonist that promotes bronchodilation. True or false? It is true. Actually, this is your main drug of choice, okay, in order for you to control everything. Albuterol may cause side effects such as tachycardia and tremors. Is it true? Yes. Because being, okay, this is an anticholinergic agent. Okay, what does anticholinergic does? It increases your heart rate, it opens your lungs in order for you to get more oxygen and improve your circulation because it will mimic sympathetic nervous response. Okay. Now, oral prednisone reduces airway inflammation and should be given on an empty stomach. Okay? We cannot. This is false. Okay? We give steroids with food because it could actually create some stomach disturbances. Prednisone should be stopped once the patient is improved or is breathing good. Okay. General rule for anything that is a maintenance medication, may it be anti-epileptic med, may it be steroid medication, may it be antibiotic medication, you do not stop it simply because you feel good. It is a continuous medication. Therefore, this is false. Okay. Nebulized albuterol has a slower onset compared to oral bronchodilators. Okay, what would be? Okay, it is false again. Very good. Because when you're talking about nebulization, it is the best. Okay, it is the best route of treatment for anyone who will have their exacerbation of asthma. Administer prednisone with food can help reduce the risk of gastrointestinal upset. We've already answered that with this one. So this is true. Okay. So much like your SATA questions, your technique of opposites, okay, would also be applied. If one of the choice is considered wrong, the other one would automatically be correct. Okay. So that is how you do it. And now, there was an update for the patient after 4 hours of treatment. Highlight the information that indicates an improvement in the overall patient condition. So, patient Mason appears more relaxed and is watching cartoons. Respiratory rate of 22 beats per minute or breaths per minute. This is an improvement. Very good. O2 saturation of 96 on room air without the need for O2 cannula is also a good indication. Speaking in full sentences is an indication of an open airway, allowing the patient to, okay, to actually speak effectively. Mild wheezing on auscultation, there is still wheezing. That's the point. So that is still not an improvement. But there is no longer any retractions that were noted. Could drink apple juice and could tolerate it well is also included. And of course, do not forget the indicators of your pain, skin color, and capillary refill that are normal. Okay, so that is your correct answer. Were you able to learn a lot today, guys? Okay, so let me just stop presenting here. Okay, so let me just go here. Oh, the question is, if you have one mistake on true or false, again, in most cases, it's going to be a, what do you call this? It's going to be a right minus wrong. Okay, let's see. Could I? Mhm. So, guys, one thing that I would like to emphasize with you, all of these questions are essentially focused on identifying if you could think well and you could think effectively as a nurse. Again, do not be afraid to get it wrong. Do not be disheartened simply because you have, like, you were not doing it great, or there's a problem when it comes uh to your to the way that you are answering it. Again, this is not about how you answer it. It's more likely on how you actually creates your decision making. Okay? So, for everyone who was able to join me, hello guys. Thank you. So, I'll be back again. Okay? I'll be back again and probably by tomorrow if everything goes out well. Thank you very much for joining me again. Final words of wisdom. In every form of preparation, there will always be pitfalls, there will always be mistake. Okay? So as much as possible, don't be afraid of that mistake. Learn from it. Because the best way for you to pass NCLEX is to continue learning and not be afraid of it. Nursing is a continuous correction of mistakes. It's a trial and error of activities and something that would be, you know, the same in the next few years. The only thing that's changing is the persons or the people who are doing it because generations could change. Thank you very much, guys, for joining me tonight and today, if you are in the Philippines. And again, be the best nurse out there. Your coach will be happy to help you.